everybody, welcome back. I'm your host Jay Stacy and you're watching The Health Talk. Today our topic will be the 5 levels of prevention. Now let me introduce our guests of today's show. First we have university student Joanne, who will be discussing what public health is and the first level of prevention, primordial prevention. Next we have healthcare manager Alisha, who will discuss primary and secondary prevention. And lastly, Dr. Kokab will be joining us to discuss tertiary and quaternary prevention. Public health focuses on the health of entire populations, to prevent disease, to advocate good health, and to ensure a longer lifespan. One of the main focuses of public health is prevention, to stop or eliminate disease. One way is by premortal prevention, which is generally a new concept that means to decrease risk to health and rise to factors that are known to increase disease or modify changes in health. For example, in my school and other types of public buildings, they have a sign that states no smoking within 9 meters. Or how the Government of Canada bans smoking in workplaces and indoor public places.
Primary prevention is defined as being the actions taken to prevent the onset of a disease or condition. To promote the well-being and prevent ailments in students, it suggests that they take measures to prevent from burning out. This can include taking breaks from working or studying. Exercise is highly recommended. Mindfulness is a course specifically taught to medical students that allows them to learn to be present in the moment and be aware of their surroundings. Secondary prevention is defined as being the earliest detection of disease or condition so it can be treated in the quickest manner possible. When coping with the demands of intense schoolwork that comes with post-secondary education, students can spiral into depression and anxiety. Developing plans and programs are a very important step in secondary prevention. This can be in the form of on-campus help from the institution or treatment sought out by the individual student themselves. Workout plans are also highly recommended in secondary prevention because it takes action against the disease itself.
The tertiary level, the 5 levels of prevention, outlines the prevention actions that are taken for the patients who have already developed the disease, injury, whether it be reversible, irreversible, acute, or chronic. Essentially, the goal is to prevent the disease to further spread. Furthermore, restoration from the illness is important, whether it be physiological or psychological. An example is that university students get overwhelmed by school, possibly work, and some of them lose control of their emotions, and it can lead to depression. And one of the ways to fix this psychological issue is to join a rehabilitation program or counseling to treat the depression. Moving on to quaternary level. The quaternary level identifies the prevention actions that are taken for the patients who may be at risk of over-medicalization, and that can have a negative impact on health and safety. Example of those are seniors or homeless that are vulnerable to excessive medication and overdiagnosis. Prevention of unnecessary screening tests or treatments is vital for the health because it can cause iatrogenic harm to the body.
And that is all for today, folks. Thanks for listening, and next week we will be talking about the Zika virus.